Hello, and welcome to the Kiss Me Med Spa Aesthetic and Holistic Wellness Show. We're so excited to bring you some really fun information, and as our shows progress, you will learn more and more about what your non-surgical options are to look good, feel good, and be good. I'm Nurse Karen.
And I'm Dr. Barry.
And before we get started, I thought I would just do a little disclaimer right up front. Any information that we share with you is not intended to be medical advice. We're just sharing facts, fun things, all of the information that we have from our years of experience in the aesthetics industry. So if you want to see us for a consultation to actually get more information about what we're talking about, you can always call our office and one of the girls will get you scheduled for that. So, not intended to be medical advice today. Okay, so now, Dr. Barry, in honor of Cupid and Valentine's Day, we have decided to bring you some information about your lips and the entire mouth area. So, Dr. Barry, why don't you talk to us a little bit about the anatomy around the mouth? And our producer has a photo he's going to put up that you can look at while she's talking.
So this is just meant to be sort of a simple overview. So around the lips, we have a circular purse string muscle, which is called the orbicularis oris. This muscle acts just like a purse string. And then attached to that are all the elevator muscles that you can see there. It's pretty complicated in 3 different locations. Lifts up the mouth both centrally and laterally. And then if you look at the lower part of the face, you can see the depressors on the lateral aspects. And then in the center area are also some elevators which allow you to go, So that's basically all you need to know for now.
Okay, so as I'm looking at that photo, what I'm seeing is there's a muscle that goes all the way around your mouth that basically looks like a donut.
Yes, that's
and
the orbicularis.
Yes,
yeah.
and as you were saying, that muscle is responsible to allow you to pucker up like that. So we naturally use all of these muscles when we're talking, but it is the overuse of some of these muscles over time as the years progress that we start to see some things that we don't necessarily like, right? So when people come in to talk to us about their lips, everybody's lips are different. No 2 lips are the same. Yours are different than mine. Mine are different than the producers over there. We all look a little bit different. So, Dr. Barry, talk to us a little bit about what makes one set of lips different than another.
So we inherit our lips. That's the bottom line. Just like we inherit our stature, whether we're sturdy or slim or tall or short, it's all inherited. So if you have a beautiful set of full lips, you can thank one of your ancestors.
And if you don't like your lips, you can blame one of your ancestors. So when people come in to have lip enhancement, what we're saying is, and correct me if I'm wrong, a large factor in the final result is really dependent on their genetics and what they're starting with. Is that correct?
Exactly. We can always enhance what you have. And the other thing we can do is improve asymmetry. That is also something that really can improve the appearance of a lip. If you're slightly asymmetric, we can definitely improve that.
So what does asymmetric mean?
Asymmetric, a good example is if somebody has one Cupid's bow that is lower than the other, or maybe one side of the lower lip, they have more lip show on one side than the other, and the other side goes up. Those are things we can definitely work with and change with the techniques that we use in order to improve that symmetry, and that makes a huge difference.
Oh, yes, and I will add to that I think most people are somewhat asymmetrical. we've all seen those photos where people take, one side of the face and put them together, and you look like a completely different person. So
Exactly.
nobody really is symmetrical. And if you're the type of person that sits in front of the mirror all day, that 10x mirror, and looks at your face, you will notice that one eyebrow might sit higher than the other. One nostril's a little
Yep.
bit differently shaped than the other. One side of your lip looks different than the other. Your earlobes might not be exactly in the same
Yep.
space. So, I don't even know if anybody is symmetrical, to tell you the truth. But some people it's more noticeable than others.
Exactly.
Yeah. So we know, between Dr. Berry and myself, we've treated thousands of lips, right,
thousands.
over the years. We've been in aesthetics for many years. Let's share with the viewers maybe how we go about designing a lip, and I'll start. So when my patient comes in to talk to me about improving their lip area, the first thing I do is I look at them from head to toe. And if my patient looks like an outdoorsy kind of a girl, very au naturel, I might say someone that, likes to go hiking a lot, or, somebody who's really not out in the public a lot for one reason or another. I'm noticing that when I'm assessing them and looking at them. The flip side of that is someone who comes into the office and has lip liner way above their lips, bright lipstick, hair, makeup done, dressed to the nines. I know that those two people are going to want a different look, right? And I would never do the same exact thing
Right.
on both of them. So talk to us a little bit about that.
What I call those two types of clients is sporty spice and posh spice. Okay? So you have to get the gestalt of the person and do the right thing for that person. And another thing is business women. A lot of
Oh,
business women
Definitely.
want to be very careful about their appearance, that their colleagues don't go, "Oh, you had filler," so you have to be careful with that too. You have to take all those kind of things into consideration.
So going back to sporty and posh,
Yes.
I'm sorry, but I'm not really that familiar with those people. So explain to us what that is.
Those are the Spice Girls.
Ah, the
Remember the
Spice Girls.
Spice
I
Girls?
do remember.
So of course, posh Spice is Victoria Beckham.
Oh, so
Everybody
pretty,
knows
right? Yeah.
she's posh Spice, right?
Mm-hmm.
Okay. Sporty Spice, I don't remember her name, but she
We're
was
sorry,
sporty.
Sporty. We're very sorry. We don't remember your
I don't
name.
remember your name. But anyway, more outdoorsy girl, girl next door kind of look.
Oh yeah, so that exactly what I was talking about. They're going to want a different lip shape, just like Dr. Berry wears her hair blonde. I wear mine dark. I'm a natural brunette. She's a natural blonde. But not all lip shapes and designs work for all people.
Exactly.
Same thing, just like all colors. Another thing I look at maybe is what are the goals of my patient? Do they say to me, I want to do something with my lips, I want to get some lip filler, but I don't want anybody to know?
Right.
So, we're very good at that because we do like a natural look, but we also know how to do a very robust lip look as well. And it's just basically you have to take all those things into account. You would never do the same look on every single person. It's not a cookie cutter
Exactly.
type service.
Definitely not.
Yes, and maybe I might take in consideration what kind of maintenance my patient is wanting to do. What is their budget is always a factor in how we come up with a treatment plan. How often do they want to see me? How often do they want to come into the office? Is this like a one-time thing? Do they only want to come in twice a year? Do they want to come in every 2 or 3 months to touch them up so they always look fresh and plump? These are the conversations that we have with people when they first come in. Dr. Berry, I do know that there is a particular lip shape, and our producer is going to put up a picture of this. It's called the M-shaped lips. Explain to us what that is.
So this is an example of the M-shaped lip. We see this a lot. This is actually my lip shape. I call this the old Hollywood glamour lip shape. Now, this has sort of fallen out of favor, but I think it's beautiful.
It's still pretty.
It is. It's the lip shape where you have a lot of a high Cupid's bow, and then it swoops down laterally from there. So all of the old silent film stars like Clara Bow up there, that was the lip shape that was desired. Now that lip shape is a little more difficult because a lot of these clients kind of want to look more like Angelina Jolie now, which has a lot of lateral fullness. Now, that you cannot accomplish, and we can pull up a quick picture of Angelina. Now, if you look at her, you can see she's pretty much a standard of beauty, one standard of beauty, but she has got very full lips, a lot of lateral fullness of that upper lip, very full lower lip. That is the very desired look these days. But what people have to realize is if they have the more M-shaped upper lip, we cannot put the same amount of filler in the lateral lip there as we can for someone like that, because then you will end up with what I call the dreaded muffin top.
Oh, talk to us about the muffin top.
So the muffin top is when you try to push a square peg into a round hole. And we see this all the time. A lot of women who have the M-shaped lip, if they have too much filler put in laterally here, it will just simply migrate up above, and you'll see a lump there. Exactly there.
Just like that. And,
Just
you know,
like
we
that.
see this all the time,
Yes,
and
we
I
do.
know our viewers see people walking around like this all the time. And a lot of times when the patients come in, they already have this, and they say, I want to get more filler in my lip.
Yeah.
And at that point, we always explain to them, well, the problem with doing more filler in your lip is what you have is already coming out and going on to the upper mouth plate here. It's not in the lips. And we were talking earlier, you and I, about there is no magic border
No.
that keeps the filler inside the pink part of your lip. There's nothing
Exactly.
that keeps it there. So when you overfill the lip, explain to us how that causes this problem.
Exactly. So a lot of people seem to have the notion that that is the border, right?
Yeah.
And nothing can cross that. That's absolutely untrue. Everything will cross in there.
Yeah.
We are using our lips all the time. The muscles are moving them. So naturally, the filler, if you put a lot in, that's the other thing. If you put too much in initially
Yes.
and don't let it integrate, it will simply go to the path of least resistance, and it will migrate up and below your lips, and that's how you get that dreaded migration look. So we have different techniques that we use, the fence posting or the Russian type of filler placement to minimize that kind of thing. But that dreaded migration,
Yeah.
you do not want that.
No, you don't want a muffin top over here on the side of
No,
your jeans,
no.
and you don't want it up
You don't
over
want it up
here
there either.
So if someone comes in and wants lip filler, we definitely want to reduce the filler that has come out of the position where we want it. And the way we do that is simply by injecting an enzyme. But Dr. Berry, tell our viewers what are some of the considerations for the enzyme that we use to reduce the filler.
So the fillers that we use are made of something called hyaluronic acid. And what I tell people, just think of hyaluronic acid as a plumping carbohydrate. It's like a spongy ball. And it's part of the plumping carbohydrates that give our skin its youthful plump look. And what makes filler different from our own hyaluronic acid is the cross-linking that is manufactured. Now, if you look behind us here,
Yes, right behind us.
you can see hyaluronic acid molecules.
Looks like water, but it isn't water. It's just clear molecules.
Yes, clear, plump molecules, and they're cross-linked. You can see these cross-links there. Now, soft fillers have less cross-linking, and the firmer fillers have more cross-links. That's what makes them stiffer.
Right.
So if you come in and you want your filler dissolved, basically what we're doing is we are using an enzyme that dissolves those bonds, and it just dissipates everything, and unbonded hyaluronic acid is just quickly absorbed by the body.
You're right. The injection works very quickly.
Yeah, exactly. Now, the one thing is that a lot of people who've had filler have not been told that if you have anaphylaxis to bee venom, you cannot have this dissolver done.
So in other words, if you're allergic to bees, if you've been stung by a bee in the past and you were allergic to it, that's definitely a consideration for reducing your filler, because we wouldn't want to induce an anaphylactic response right in the office.
Exactly, because the dissolver is just synthetic bee venom, actually. So if you have had anaphylaxis, you can't have it dissolved.
No, you just have to
So-
live with your muffin top.
Yes, and let it go down.
And sometimes, believe it or not, they will tell you that, we get asked this all the time. How long does filler last? Well, the body breaks down filler at whatever rate it's going to break it down.
Yeah, exactly.
Just like one person's body has a fast metabolism to burn calories, someone else hangs on to every calorie they ever ate. So it's really impossible to say how long your filler is going to last. And I can tell you that I have met people that their filler was years ago.
Yes.
And it's still in there for some reason, and it's still way up here creating that muffin top. Some people don't want to have that filler reduced. They actually like it, and they think that that's the way it's supposed to look, and they want us to add more. It really isn't something that we want to do.
Exactly.
Because as we were saying, there's no magic border that keeps the filler inside of your lip. So if you've already got the filler coming out on the upper mouth plate above your lip line where you would put your lip liner, if the filler has already come up there and we go in to put more filler in your lip, guess where it's going to go? It's going to go up there, and that is going to get even more pronounced,
Yeah.
and you end up with that cartoonish look
Yes.
that we don't think is very
Marge
pretty.
Simpson.
Yeah, it's cute for her, but we don't want to look like that. So we have been talking about lip filler. All right. Pretty straightforward. But that isn't the only thing that we can do to enhance lips. All right. Sometimes people will come in the office and they'll say, I want to do something about my lips, but I don't want to have filler. Is there anything I can do? And I can tell you yes. And in fact, we have a little video that our producer is going to put up that you can watch where I'm explaining treatment that we offer in the office as an alternative to lip filler. Well, I'm not sure where the video went, but
Try another one here.
okay. There we go.
You can talk over it, there's no sound.
Okay. So what we're doing there, that's Nurse Regina there, we are doing a treatment called Lip Laze. It's done with our Fotona laser. And what I'm talking about in the video is she's just taking the laser and we're lasering inside the lip on the wet portion, and then we laser on the outside of the lip where you would put your lipstick. And the final step would be where we do a very light laser resurfacing on your vermilion border. That is the area where you would put lip liner. And this is a nice, slow improvement of the lip area. Every time you come in, which incidentally is once a month, you get the treatment done. It takes about 15 to 30 minutes to do, depending what we're doing. And each time you come in, you're slowly building collagen. It, as Dr. Berry said, it is the collagen that causes our tissue to be firm and give some bounce back to it. So this is a great alternative for people who would like to improve the lip area but don't want filler. I myself, Mike knows, the producer knows that I'm a trumpet player, as was he. And so people like myself, we can't have lip filler because number one, we would smash it. We don't want to smash it. And number two, it would impede our ability to play when we put the mouthpiece up to our mouth. But I too would like to have my lips enhanced, you know, as I'm getting older as well. So that is a treatment that I love. It's a great alternative. I can do it and I can still play the horn. So that's a nice alternative. So even though you may not want filler, there are some things that we can do to improve your mouth area. Another thing we can do is we can do an injectable hydrator. This is a off-label use of a product that is made with hyaluronic acid, but the cross-linking is very mild and very minimal. So when we inject it into areas of the face, on the cheeks here or in the lip, it will just kind of replace some of the volume that you've lost that are making your lips wrinkly. You know, nobody wants to have those wrinkly lips, so we can do that. Another thing we can do is a lip flip. Dr. Berry, you want to talk to us about the lip flip?
So the lip flip, if you think back to the anatomy picture that I showed you of the purse string muscle, the orbicularis, it pulls down and together. So we can do a little bit of Botox across that top medial vermilion border area to relax the purse string effect, and it just sort of relaxes it and lets the lip flip up.
Right. And we just put a very small amount. If we put a large amount around the mouth,
Yeah.
they wouldn't be able
No.
to form their words.
You
They
wouldn't be able to talk properly. So we
No.
can do a little bit.
Yeah, we can do a little bit without really affecting the way that you speak. As we said, that muscle around the mouth is like a big donut, and we're just putting tiny little bits of a neuromodulator here and there to just cause the lip to flip up a little bit. So you see a little bit more of your upper lip, and also we can do it underneath the lip to have the bottom lip flip down. The goal is to have your lips go like this to where you have a little bit more of lip show. Now, this doesn't work for everybody. And I find that kind of amazing because when we inject neuromodulators like Botox or Dysport or one of those in the upper face, they always work.
Works for everybody.
It always works. But when we do it around the mouth, some people say, oh my gosh, it looks great. Other people, well, I couldn't tell at all. So that's one reason why we came up with the Kiss Me Lip Flip, which is what we call it. We do a little bit of that neuromodulator around the mouth, and then we do a tiny, tiny bit of Botox in the central part of the lip to actually make that
You mean
lip.
filler.
I'm sorry, yes, filler. I'm sorry. To make that lip actually flip up.
Exactly. And,
Right?
and the way I consider that is just kind of reframing a house that's kind of where the frame is kind of collapsing in. You just bring the frame back up. And so when you smile, instead of your lips falling down and in, they tend to fall outward, I guess, or fall up and away. So I find that helps a lot and looks very natural.
It is a very natural look. So I can't tell you how many times people come into our office and they want to do something, but they don't. They say, I don't want to look like, and they always mention somebody. Or they'll bring a picture and say, I want to do something with my lips, but oh God, I don't want to look like this. And they show me the picture on their phone, right? So that was one thing we were talking about earlier today, about how many times, and we've worked at places like this, they force you to buy more filler than what you really need. You want to talk about
Right.
that a little bit?
So what I love about Kiss Me Med Spa is that you can purchase partial syringes. So when you see women whose lips look overfilled, that is because when they lose a bit of volume, they go back and they want a little bit of volume, but they are forced to buy another full syringe. So then you get this really strange stacked look, and it gets bigger and bigger and more artificial. Whereas what we do is we just assess it, and we'll tell you, I think you need a 0.2 or a 0.4 or a half syringe, and you can just purchase partial syringes just to bring you back
Yeah.
to the baseline that you liked.
Right. And oftentimes people will, when they're coming in for their neuromodulator like Botox or Dysport or one of those, they'll say to us, do you think I need lip filler yet? And, most of the time it's, no, not yet. You still looks really good. It's like anything. You get used to looking at yourself in the mirror every day, and all of a sudden you don't even notice how good your lips really look, and you think you need it again. So we will definitely be honest with you, and we will help guide you and say, no, not yet. Let's check it again in about 3 months. Every time you come in, for your regular injections or your facial or whatever you're coming for, your laser service, we will look, and I promise you I will tell you when it's time to touch it up. We won't let you go around with that dreaded muffin top. That is not our goal. So we really had a good time today bringing you information about things that you can do to improve your lip area, to enhance around the mouth. If you're interested at all in getting more information, please call the number that's on the screen there. It's 559-838-0500, and just tell one of the girls that answer the phone that you'd like to come in for consultation. We'll go over all of your options for you regarding, the mouth area, the lip area, and as our shows progress every month as we come in and do this, we're going to pick a different area of the face to talk about, and we'll go over all the options with you, because one size never fits all. Do you remember how they used to sell pantyhose?
Yeah.
That said one size fits all, and you
It
go to
does
put
not.
your foot in there and it won't even come past your knee?
That's a scam.
Yeah, there's no such thing as one size fits
There's
all.
not.
No. So we hope you've had a great time listening to us, and we look forward to seeing you soon. Bye-bye.
Bye.